Thanks, Adam. Here's what we know about the coronavirus in Nebraska tonight. Douglas County has reached 102 deaths. There are an additional 87 positive cases, bringing the county's total to more than 7,800. Statewide, there are now more than 20,400 cases and more than 280 total deaths. The Douglas County Board was the only county in the state to receive money from the CARES Act. Over the last month, they've begun spending the $166 million allocated to them. Some of that money going to infrastructure updates at the Douglas County Health Center, specifically the HVAC system, which badly needed upgrades. As reporter John Kipper tells us, while replacing the system may not be flashy, it could save lives.
The Douglas County Health Center is a last resort for many county residents with long-term ailments and illnesses. The residents stay in an aging building with an old airflow system.
The air handlers that are in there, they're functioning, they're adequate, but they're also aged. I mean, everything was adequate until you get a pandemic that we haven't had in 100 years.
COVID-19 hit the Douglas County Health Center especially hard. As of Thursday, 24 residents and 19 staff members got the virus. 6 residents died. Everyone else has since recovered.
You hit, unfortunately, a certain age, and if you have conditions, you might not be able to fight back.
Director of Public Property Jerry Leahy immediately pushed a purchase of negative airflow machines, putting them in throughout the health center. Commissioner Marianne Borgeson can't say the old infrastructure contributed to the spread, but does say new machines slowed it down.
I don't know if we can go back and say that. All I know, what I can say is when we put them in place, it definitely helped the airflow within those neighborhoods.
The county health department agrees.
I don't think you can say that it contributed to anything, but we certainly know that it wouldn't be as helpful as a newer system would be.
But that was just a temporary solution. The first purchase the Douglas County Board made with their $166 million in CARES Act money was an overhaul of the HVAC system in the health center, making sure the entire building has the best airflow possible.
Those folks are our responsibility, and we should be doing everything possible that we can to make sure that we're providing a safe environment, and this is one way to do that.
According to the law, the county must install the system by the end of the year. It'll be in Omaha by late fall, and they'll quickly get it in place to make sure they're ready for a potential second wave.
You're going to, again, need that positive airflow within that whole facility in order to keep our residents safe, whether you have a vaccine or not.
Now, improving the airflow in the health center is not the only thing the county is doing with CARES Act money. They're also installing automatic faucets, improving the whirlpool system, as well as adding isolation rooms. All of this with the hopes of eventually containing the spread of coronavirus or anything else that may come up. Reporting in Omaha, John Kipper, 3 News Now.
The county also is spending more than $5 million replacing the airflow system in the county jail. The jail saw a much smaller outbreak than the health center.